On behalf of Prathima Hospitals and as an individual practitioner, we have to commit ourselves for continuous medical education. Now, it became a part of our practice of medicine. I saw my grandfathers who practiced medicine at those eras. When it comes to my mother and Kondal era, have seen that generation also. When I'm seeing the newbies, the era of practicing of medicine has changed a lot. See, with the development of years, the new Gen Z, the so-called the keywords, okay? So they are having the new expectations. With those expectations, we have to also change. Paata chintakai pachada annattu manaloda pakkaku pettestaru. So we have to evolve ourselves to how to practice, how to tackle the patient and the patient attenders' emotions, commitments and expectations. See, these are the things we get to know by interacting ourselves with other partners, like other doctors in other community areas or other paramedical staff who encounter with so many other people. We ourselves doctors, we encounter with patient and patient attenders to a limited amount of time. But there are other people, the paramedical staff, the administration staff, they encounter with these other people a lot of time. So these people will give inputs here and there. Sir, this patient has these expectations, please try to counsel here and there. So then we get to know, see, these are all the old practices which our seniors or our family members used to practice earlier and we're continuing. But in the recent trends, we have added some digital component to our practice. So when it comes to old senior practitioners, newer tech, by attending CMEs, as earlier Dr. Srinivas Rao sir, he is my senior during my internship in Gandhi. So we were a part of Juda. So we actively participate in so many other activities in Gandhi Medical College. So later, now he became vice chairman for TSMC. I'm happy to see him on this role. So he has mentioned that we need to add credit points. Like in other countries, there is a license exam. For every few years in United States, we have to renew our license by writing exam. As in India, there is no exam like that for every 5 years. But instead of writing exam, we have to attend CMEs. I mean, just now I got to know from Srinivas Rao sir that we have to get 30 points for renewing our license. So by attending this CMEs for 8 hours for a day, sir has informed me that 2 points will be added. So if you break down, we have to attend 15 CMEs in a span of 5 years. I think in the span of 5 years, we can attend more CMEs than the mentioned subscribed what TSMC has told us. So the senior doctors having the idea of practicing, so they're getting to know by attending. My mother, she's a gynecologist. She's practicing obstetrics and gynecology in the other branch, Kukatpally. We have one more branch in Kukatpally. So normally she attends the CMS. I generally used to ask, why do you attend all these CMS? She used to say me, now these IT people are coming. The patient attenders previously, they were nice. Okay, if we tell something, they will listen, they'll go. Now these new IT techies, not only in that's part of the city, it is the same common problem in all areas, in rural part of Telangana or in rural part of India. Thanks to Modi ji, because of the digital network expanded, every guy is having access to the smartphones. So everyone is accessing to Google, like someone said in the crowd. So every person, post-COVID, everyone became a Google doctor. I think most of our doctors have encountered these what you call complaints. I think one of my friend, he's a physician, he's a psychiatrist. He kept a board outside his consultation room. If I tell the consultation fees is some X, if you ask me that X will be turning to 2X. So right now, the patient and the patient attenders are keeping on asking, okay, it is their primary responsibility because they are anxious. They will ask. So we should also, as a medical practitioner, we should have more patience than them to answer their doubts. So when it comes to newbies, I've seen some new doctors who graduated from medical schools. During our post-graduation or undergraduation, we'll have a bookish knowledge. We'll read textbooks, or our professors or our seniors will teach how to practice medicine or how to do surgery or how to do some other things, irrespective of the department. But when it comes to reality during practice, it's not bookish knowledge. It is a total different of practical knowledge. We have to understand the emotion of the patient and the patient attenders. Apart from that, there are some other problems during practicing. Maybe it might be billing or due to counseling. See, every doctor can't spend hours and hours counseling to only one patient because they have to see some other patients. There are other staffs, our assistant or our junior doctor or some administration in the hospital. They have their own role, importance in the patient. So the new doctors should take advice from the seniors, or by attending CMEs, you need to network yourself with the senior doctors so that you will have a knowledge how to practice. And second most point, just now I've asked Dr. Srinivas Rao sir again to give a brief idea regarding MLCs. Of late, when I'm seeing at Sridevi madam, I can tell a new gynecologist, for example, okay, for MLC cases, ER emergency doctors or physicians, they have idea. Senior gynecologist, they have fair area. For a junior gynecologist, if she is a recent passed out, if a patient of minor age, below 18 years, with no physical abuse, if she comes down to OPD or IPD, okay, admit the case. But here is a point where we are missing. We have to register an MLC case. Because recently, one of my known associate, one of my junior, she's an obstetrician. She just passed out recently. She had encountered, she team came and immediately questioned her. And they troubled her hospital. It is that hospital is in two-tier city, but still, she's a recently passed out. She doesn't have an idea of MLCs. In medical school, nobody gives the idea of MLCs. In hospitals, during practicing or working under senior, we'll get to an idea of MLCs. So this is the area where our doctors, the not junior doctors, they recently passed out, postgraduates, during practicing, when you come to the world of practicing, you have to get knowledge of, apart from medicine, there are so many other areas where you need to get an idea how to practice medicine. So by attending CMEs, by networking with seniors, we'll get to know. See, they have their experience. See, if a doctor who's practicing from a decade or 2 decades, he must have encountered n number of things during his practice session. So these are the things we have to learn from our seniors. So I request the junior doctors, please attend CMEs, encounter with senior doctors, surgeons, and learn from them so that it will be helpful for you in future of practicing. So thank you one and all for giving me this opportunity to share a few words. I think I didn't take much of your time, and I wholeheartedly thanks Department of Cardiology, Dr. Kondal sir, Dr. Sahoo sir, and Dr. Rachel madam for conducting a very good topic of heart failure, where in recent days, one of my known associate, a close associate, had affected heart failure. Thank you, Manan.